to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers TV can transform your content journey today.
You're watching Rogers TV. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a nurse for the Grey Bruce Public Health. Today, we are going to be discussing vaccine preventable diseases and the program particularly focused on vaccines for seniors. So Andree, welcome to the program. Delighted that you're with us today.
Thank you so much for having me, Carol.
I also want to thank you for the questions that you sent ahead. It always makes my job so much easier when I've got something to follow. But I'm also very, very interested in particularly the shingles vaccine. But before we do that, I'm wondering, how long have you been involved with the role that you're doing now?
I've been with Grey Bruce Public Health, specifically in the vaccine preventable disease team, since 2019. So it's been a few years since I joined the team. My background is in infectious disease epidemiology. Prior to being a nurse, that was kind of the work I did. So it came naturally to join public health as a nurse once I got that education.
Excellent. Now, I know we're going to focus on vaccines for seniors today, but there is a program, Immunization Through the Lifespan. And I'm wondering first if we can talk about that and about Ontario's publicly funded vaccine schedule. So why is this so important?
Yeah, so the publicly funded immunization program in Ontario is designed to keep people healthy throughout the life course, kind of as you mentioned. So it starts with immunizations that are funded for anyone really who's living in Ontario. They don't necessarily need to have an OHIP card through if you come through public health. Obviously, a little bit different at a doctor's office, but it's designed to allow people to be protected from some of the most common and harmful infectious disease that sometimes we see and now we see a little bit less of, but that we try to prevent reoccurrence in our population. So that starts from 2 months and it goes all the way up to 70, 80 plus years.
And we are talking seniors because here in Grey Bruce, and particularly in Owen Sound, but in other parts, we have a lot of seniors who are enjoying our life here in Grey Bruce. So yeah, across the lifespan is critical for sure. So moving on to seniors, I'm wondering if you can, talk to me a little bit about the vaccines that are recommended. Sometimes as we age, we don't think of vaccines quite the same. So I want you to tell me why I should consider it to be so important, even as I'm getting older.
Yeah, so I think one of the ones that we tend to get a lot of questions about is shingles. There's been a lot more attention towards shingles as an infection and also shingles as a prevention strategy through immunization. So shingles is a really painful rash that results from the reactivation of varicella zoster virus, which is actually the same virus that causes chickenpox. The rash generally appears on one side of the face or the body, and often in like a single strip, almost like a zebra stripe, on a band of blisters. So it can cause pain, itching, tingling, or numbness. Usually occurs even up to several weeks before the actual immersion of the rash. It can be quite severe, and I think in some cases can lead to complications such as debilitating nerve pain, which can interrupt your ability to live a normal active life, and also blindness. It's quite common. About 1 in 3 Canadians are expected to develop shingles at some point throughout their lives. And older adults and those who are immunocompromised really are at the most increased risk of getting the illness, as well as at increased risk of the most severe complications. But age is actually the greatest risk for developing the illness, and 2/3 of cases in Canada are people over the age of 50, which is why we try to explain to people that this is something that does affect older adults, and we try to prevent it as soon as we can.
So older adults doesn't mean necessarily seniors, right? When you say over 50, I don't think of over 50s as seniors.
Yeah, so we definitely we see the increase of those risks of those illnesses start to happen in some of these infectious diseases closer to 50, but we see the most impact by immunizing our seniors. So that's why often our eligibility criteria kind of focuses on seniors, because you get the most impact and you have the most impact for those people over that age.
Now, you mentioned blindness can be one of the debilitating results of shingles. How does that happen?
So basically the nerve, what happens is the reactivation of that chickenpox vaccine infects the nerve, and that damage that is caused to the nerve can also happen in your optic nerve, which is the nerve that helps you see. So that's where we see those complications. And it's the idea of like when you get that debilitating nerve pain from the damage of the nerve, we see the same thing depending on where the nerve that is being impacted is.
So someone who, when you say reactivated, in other words, the virus is dormant in our, and
yeah,
then
that's exactly it. So this is part of the reason I guess a little bit of a diversion is that we're immunizing now for chickenpox. And the hope is that long term, we'll see the cases of shingles go down because that varicella zoster virus won't be living dormant in people's bodies. So there is, like I said, a very much an attention on the seniors population because they're the most impacted, and we're hoping that this problem will dissipate as we continue to immunize children and young people for chickenpox.
So it can be a couple of weeks before the rash occurs. And then when the rash occurs, how long before things settle down, would you say, approximately?
Unfortunately, it really varies from person to person. People who are at lower risk of more complications might see improvements in a few weeks. And for others, it can be months of difficulty and relapses. So it's really important that we prevent it so that people don't have those long-term complications.
Nerve pain. You mentioned it several times. Is that different than other types of pain?
Yeah, I think a lot of people talk about it as a throbbing or a burning or a tingling sensation. So it is a bit different than a sprained ankle or pain in a muscle. It can travel throughout the body. So often, as you can imagine, the way that the nerves travel throughout the body, that's how that pain can be perceived as a burning or a gnawing sensation, not necessarily the same pain as when you would break a bone. It's much more constant and for some people, or others can experience zaps of pain, almost like a bolt of electric shock.
Wow. So from what you're describing, paying attention to the shingles risk and also considering being vaccinated for it is actually a pretty important thing for quality of life, because I can't imagine that it would be very nice going through this whole process at all, not just from time frame, but from discomfort.
Absolutely. It's the good thing is shingles itself isn't contagious. However, because it is caused by the same virus that causes chickenpox, individuals who do have shingles or are currently experiencing that open blistering rash should stay away from anyone who is immunized and hasn't had chickenpox. This is particularly important when it comes to pregnant mothers and young children. And yes, that includes grandchildren, unfortunately, because vaccination still does remain the best way to prevent shingles.
So that is the main way to prevent shingles.
Absolutely. There are 2 vaccines that we offer in Ontario. There's the Zostavax and the Shingrix. So prior to 2020, we did offer Zostavax as our primary publicly funded to eligible adults. And then we transitioned to offering Shingrix, which is probably the one that most people know about, in the fall of 2020. And it does provide better protection and more prolonged protection. So today, that's what we offer to all eligible seniors.
And it's free.
It is for all eligible seniors, yes, 2 doses.
When you say eligible seniors now, what does that really mean?
Yeah, so basically it's free for anyone between the ages of 65 and 70 who have not previously received a publicly funded Zostavax immunization. So for example, if you received your vaccines prior to 2020 and that was paid for by the government, so publicly funded either through your doctor's office or through us, then unfortunately you're not eligible to receive a second publicly funded Shingrix vaccination. But if you previously paid for your Zostavax, so for example, you paid it out of pocket or your insurance covered it, and you are between that 65 and 70 years of age, you are eligible to be re-immunized with Zostavax. We just ask that you wait at least 8 weeks between receiving your Zostavax and your new Shingrix vaccination.
So would your recommendation be that for someone who had already the immunization to really seriously consider getting the additional one because it protects more? Is that your
Yes, absolutely. We continue to recommend people who have had that Zostavax to receive the Shingrix outside of that 8-week period. The difference is quite significant. For Zostavax, we're looking at about 50% protection. And in some of the short-term data that we have for Shingrix, we're looking at 95% protection.
Wow.
So it can be quite significant. Obviously, we need more data long-term to see how long that protection lasts. But we know that we have at least that good 95% protection for at least 4 to 5 years.
That's significant, actually, to have that change in the percentage of protection. Now, you mentioned 4 to 5 years. So are you saying every 4 to 5 years? No. How long, if I really got the good one, the most recent one, I mean, they're both good, but one protects better than the other. How long can I go with that? Do I need a booster?
So Zostavax was a type of vaccine that we only gave 1 dose of. So it was what we call a live attenuated, which means that it's a weakened form of the actual virus that we give people. Usually those have pretty good long-term protection. Maybe the intensity of the protection can be different from vaccine to vaccine, but generally we have good long-term protection with 1 or 2 doses. So that was always a 1-dose vaccination. And with Shingrix, it's just 2 doses, 2 to 6 months apart. And that will give you what we consider lifetime protection. It's just that data of knowing how good that protection is past that 4 years is not written in stone quite yet.
Gotcha. So what if I'm not sure? What if I'm not sure, whether I paid for one originally, whether it was funded? How do I find out where I am with my immunization status? Not just for shingles, but for any of the immunizations.
So there's kind of 2 ways we tell people to kind of get a copy of their record is always reaching out to your family doctor if you have one, and seeing what they have on file. Additionally, if you're questioning whether or not you got a publicly funded one, maybe through us, you can always check in with us. There's a couple ways on our website that you can look, and then you can put in your health card information and get your vaccination record that we have on file. If for most of our seniors, we definitely recommend their doctor. Family doctor is going to be the best person to contact. But if for some reason that is not successful, they're always welcome to reach out to us at Public Health.
That is so helpful because, it's just important to have the accurate information and to have the answers even before you proceed. So for someone who might want to proceed with the vaccine and to get vaccinated, where can they go to get it? Their doctor's office, public health?
Yeah, so we recommend if you have a family doctor, that's the best person to reach out to. They have your previous health history and they're the best person to reach out to. If you don't have a family doctor or for some reason you are far away from your family doctor, public health is a great place. We're happy to see people who are either without care or, for example, are far away from their normal care.
Now, more and more we're hearing that there are pharmacies and pharmacists that can give injections as well. Is this one that a person could go to as well to get it, or is this just the doctor or public health?
We always recommend reaching out to your doctor first. They're usually the best person to talk to. And then if for some reason that's not the right course or you don't have a family doctor, you can definitely reach out to your pharmacy and see if, depending on who is working in the pharmacy and what their status is, they might be able to offer it and maybe not. So it's always a good place to check as well.
That's really, really helpful. Now, for someone who's had shingles, are they okay then? Are they protected, or do they still need to get the vaccination done?
If you've already had shingles, we still recommend that you get the vaccine. Having the illness once does not mean that you can't get it again, which is always one of those things. We wish we could tell people if you've had it, you don't ever have to worry about getting again. But a lot of the vaccines we offer are that way, that just getting the illness does not necessarily mean you have the protection.
Interesting. So, yeah, I occasionally, these misunderstandings can be part of coffee conversation. Oh, I'm okay, I've already had it. But you're saying that's not true.
Yeah, it definitely can hit twice. We hope that it doesn't. But if you're at risk of having it, then you can also be at risk of having it more than once, unfortunately.
That's nasty.
It is. You would hope that once would be enough. But
Yeah.
For those who have had the illness, we do recommend they wait about 12 months, at least 12 months after the episode of their shingles after they've received the vaccine, just because it's not nice to have a strong immune response to something that you're currently fighting off. And we want to make sure people are feeling well and healthy and able to receive their vaccines.
Now, you mentioned that this vaccine is slightly different in that it's got, I think you said the live virus, or
the Zostavax with a live virus. This one's a little bit different than that one.
Okay.
So Shingrix is a recombinant vaccine, which basically means that we take a part of that virus, we crush it up, and we present it to your immune system with something we call an adjuvant. And an adjuvant just encourages your immune system to remember those pieces of protein so that it knows how to fight it if it were to ever see it again.
So for someone who is perhaps a bit apprehensive, never mind about injections, but about vaccines, what could they expect from getting the shingles vaccination?
Yeah, so similarly to most of the vaccines that we see or that we provide, the most common side effect is pain, redness, swelling at the site of injection. And that's mostly as a result of the injection and not necessarily the immunization itself. But you can treat it with a cold compress and an over-the-counter pain medication like Tylenol or Advil. And some people, we do see this a bit more common with Shingrix. Or shingles vaccine in general, that people might feel fatigued or fever or chills and body aches, but those do improve 1 or 2 days after immunization. So we just say rest, drink plenty of water, and if you have any concerns in the days following your immunization, reach back out to the person who provided it to you, and they can help direct you to what appropriate care you might need.
So this may be an unfair question, and I don't mean it to sound that way, but am I going to get shingles from the vaccination?
No. So this is part of the reason why it's really nice that it's a recombinant vaccine. So even if you're immunocompromised, this is a good vaccine for you. It doesn't have the ability to give you the disease. It only has the ability to tell your body how to fight that disease if it were to come into contact with it.
And that's an important point, because sometimes people can be a bit hesitant and saying, because of the manufacturer and how this encourages your body to respond, it doesn't actually give you the disease.
Yeah. And I think we all understand the concerns about that, but we always do our best to educate our clients when they come in about what they can expect and what their normal expectations are and what to do if they were to be concerned about any possible reactions. And we do monitor clients for several minutes after 10 to 15 minutes after they've received the vaccine to ensure that they're not having any rare side effects like an allergic reaction, so that we're there to help you if something were to go wrong.
Excellent. And when you describe what people might expect for a few days after, compared to the actual when you get the virus, how long it can go for and the discomfort. I mean, it certainly would be encouraging for people to really think seriously about being protected, for sure.
Absolutely.
Thank you for that about the shingles, because certainly that's an important, really important topic to discuss. But I want to move on to maybe one or two others. And talking about the pneumococcal and RSV vaccination. Can you tell me what RSV means?
Yeah, so RSV is respiratory syncytial virus. So it's a long name.
Because I knew I wouldn't be able to say it well.
It's a big name, but generally it's actually a very common respiratory infection, but it can cause more severe outcomes for people under 2 years of age and over 60. But again, it is a very common virus. It causes upper and lower respiratory illness. But like I said, it can cause severe complications for people under 2 and people over the age of 60.
Are you seeing more of this? Is this a trend that where people are experiencing this type of illness?
So RSV has actually been around for a very long time. I think there's been a lot more attention towards the virus in the last few years, especially post-COVID. We saw quite a dramatic increase in respiratory illnesses, COVID and non-COVID related, after the pandemic. People were so good at keeping themselves safe and healthy during the pandemic that when we re-engaged with our normal lives, we often got some of that backlog of infection that we hadn't gotten for a few years because we were keeping ourselves safe. So there was a lot of talk around RSV, especially for young children in the few years following the pandemic. So I think that's where a lot of the conversation is coming from, is seniors are wanting to protect their grandchildren and they're not wanting to put them at risk of needing to be hospitalized, which is unfortunately one of the most concerning outcomes of RSV for children under 2. So and for obviously our seniors as well. We don't want people to be ending up in the hospital. And unfortunately, because there is no treatment for RSV, all we can do is prevent it. And if you are to get it and get very ill, we provide supportive care in the hospital, which could be oxygen and fluids. But unfortunately, there's nothing we can do to actually help you cure the illness once you've gotten it.
That's a concern, especially when people may not be as strong as they could be, the immunocompromised individuals as well.
Yeah.
So we did talk about how would people feel after they got a vaccination for shingles. Can you tell me, is the reaction the same for the vaccine?
Yeah, so with RSV, we definitely still see the same, like redness, swelling, pain, and warmth at the site of injection. And that's really the most common thing. And some people might feel a little bit ill and under the weather in the few days following. But again, it should be very minor and resolve within 24 to 48 hours.
So when you think about it, for the pneumococcal and RSV vaccinations, there are certainly certain age groups that are really at risk, and that's those at the beginning of the lifespan and those seniors towards the end of the lifespan that are primarily at risk. We've talked in previous programs with public health about herd immunity, protecting larger groups. Can you explain a bit about why all of us can care for each other by becoming immunized?
Yeah, so one of the things that happens is we saw it happen after COVID, which was basically everyone stayed well. And as a result, people did not develop any immunity towards some of the normal circulating viruses. And so as we are better protected through immunization, or in some cases through natural infection and natural immunity, we make it harder for the virus to spread across. So think of every immunized person as kind of a blockade or a barrier for that virus. So if there are many blockades and many barriers or many obstacles in the way of that virus, it not only slows it down, but also makes it more difficult for it to spread. And so when we talk about this herd immunity concept, we are asking for people to actively become barriers for the spread of viruses, especially for something we do talk a lot about viruses because it's more difficult to treat than something that's a bacteria, which is why a lot of attention goes towards viral infections for immunizations, but it does also work the same with bacteria, that we want to prevent the spread of these bacterial infections. And if we can do that by giving people immunity without the risk of acquiring the illness, that is a great way to protect your neighbors, your grandchildren, and yourselves.
And it's interesting, the perspective of grandparents wanting to protect their grandchildren. I mean, when you think about it, often grandparents fill in for parents who may be working or doing other things, and so that they're a key part of a family, and protecting each other in the family is obviously important. Now, I know we've got about 3 minutes left in the program. It always goes by so fast. I'm wondering what you would like to highlight as part of your message today.
Yeah, so generally, we always tell our communities that vaccine are a really effective and safe way of preventing illness in our community. And there are several vaccines available specifically for seniors to help protect them from illnesses that they might become more at risk as they age. And I think a lot of your viewers too, they're very engaged members. They like to stay active and well. And as we know that as people get sick when they're a little older, it's harder to recover. And we just want to give you as many and as much time to enjoy your life as possible in a well place, which is why we always recommend vaccination. Also, I think just to kind of pop back at some of the pneumococcal and the RSV, pneumococcal actually doesn't have, for eligible seniors, it doesn't have an age limit. So if you're over 65 and you haven't had your pneumococcal vaccine before, it's a great vaccine to get, even if you're over 70. It does create some significant benefits to protect you from some of those adverse events of pneumococcal. And then to pop back into RSV, that one is a little bit more narrow eligibility criteria. So we do recommend you talk to your doctor if you have concerns that you might be at higher risk, but generally anyone over 60 who's also living in a long-term care facility or has a significant immunocompromisation, those are the people who we're looking to speak to. So ask your doctor and reach out to public health if you have any concerns or questions.
Excellent. You mentioned earlier that people who don't have a health card could qualify. So that messaging would go out to what groups of individuals?
So basically anyone who's visiting. If you're visiting the area and staying for several months, this is where our influenza program also is really great for, or if people are living here for several months with a young child or with an elderly senior, we can see them. And then there's also our more transient population who may not have an address to have an OHIP card. We're just happy to see them and make sure that they're as healthy as anyone with an OHIP card.
Excellent. And that's important to know for sure. Andree, I want to thank you so much. I've certainly learned, and certainly the information you've shared is so valuable for our community to keep everyone health and safe in our everyday living. You've been watching HealthLink. Andree Chartrand, public health nurse, Grey Bruce Public Health, discussing vaccine preventable diseases, the program, and especially vaccines for seniors. Thank you for joining us here on the program, and please take care. Listen again for more information about programs, resources, and services available to you and to your family. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
With Rogers TV, you can cheer on the home team from the comfort of your living room. We'll head to the rink, the field, the court, or the pitch, so you don't have to. Tune in and cheer on your local amateur athletes on Rogers TV.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special